Hi, I'm John Barras. I'm a dentist in Houston, Texas, and I treat a lot of TMJ-related issues. I agreed to answer a few questions, online questions, and one of the questions Lauren asked from Houston was, Dr. Barras, how do you treat TMJ neuromuscularly, or what does a neuromuscular dentist do to treat TMJ? And what I do in our office is we look at the teeth and the relationship of the teeth, how they function together. We want the teeth to be in a good alignment. We know that the muscles on either side of the jaw are balanced with good arrangement of the teeth coming together. So a lot of pain and problems that we see are related to a bad bite. So as a patient comes in our office, what we do is we take photos and we take a real good look and study to see if the bite may be an issue related to TMJ problems. So what we do know the majority of the times a bad bite is the problem. So in essence, what we're doing is treating a bad bite. In our office, we try to, before we do anything permanent, to try to balance the bite to where it's stable on both sides. And we do that by placing an orthotic after doing copious measurements, running bite analysis, and measuring muscle fatigue with an instrument called a K7 machine. Once we do that, then we can see what kind of bite that the patient is in right now, and before we do an orthotic, and then once we place them in an orthotic, we can see if we're making improvement and really try to dial in the bite to where it is functioning all the way around in equal balance on both sides. Typically what happens is that once the balance is there, the muscles defatigue because they become more stable on both sides. Once they defatigue, then the patients typically start feeling better. We do this over a course of about 6 weeks, and we're evaluating each appointment to see how things go. If the patient is feeling a lot better, at that point we can give the patient more of a permanent solution. Some of those solutions may be moving the teeth into that same position that the orthotic is in with like braces or Invisalign, and using the orthotic as a balance. The other thing, if the teeth are worn or cracked or way overused or overclosed, we can build the teeth back up into that position with crowns or veneers. So Lauren, I hope this answers your question. If you guys have any further questions, please feel free to give us a call at our office, 713-993-9814.